All right, guys, welcome back to another episode of Filming In, where we dive deeper into the world of aesthetics. Hello.
Hi.
Hi.
How are you guys?
Good. How are you?
Good. I miss you.
I miss you too. I feel like it's been ages.
I know it feels weird doing this virtual.
I know. But hey, we made it happen.
Oh yeah, this is great. We made it happen. Joey made it happen.
Yeah, and I feel like Joey should teach this because I feel like I earned my associate's degree in IT for putting all this
Proud
together.
of you. So proud of you.
Oh my gosh. We are here with obviously Nicole and
Yes.
and we have a special guest today.
Hi, everyone. I'm Cory Stewart.
This is Dr. Cory Stewart. This is also my other half. And he's joining us today.
Thank you for having me, guys.
Yeah, we're very excited to have
I feel
you.
so honored and, learning from the best.
I mean, he was forced. It's fine.
Didn't have a choice.
Didn't have a choice. Oh my gosh. But how was your trip and everything, Nicole? Was it
We
fun?
had so much fun. So much fun.
Yeah. You guys were in the Hamptons?
Yeah. 3 days.
Oh my God.
I ate way too much.
It's okay.
So much good food out there. Oh my God.
You're on that Peruvian fit journey though. So.
That's right. That's right. Back on the diet.
But Nicole and I wanted to bring on Cory or Dr. Stewart. Can we just call you Cory?
Yes, please just call me Cory.
Okay, great. We wanted to bring on Cory because we thought it would be a really nice addition to have a physician with us, and he's also a board-certified family physician. He just finished his residency in family medicine here at St. Joseph's Hospital in Syracuse just in June. And he's starting as a attending physician at a private practice in the area. And there's a little bit more that he's doing, and we'll dive deeper into what he's also doing on the side as well. So thanks again for joining today.
Thank you for having me again, guys.
So excited. So we talk a lot about obviously fillers, Botox, skincare, all that good stuff, but I don't think we get to hear a lot about weight loss, which I know you guys have launched a really good weight loss program. So I feel like that was something we really wanted to discuss with our audience because it's a huge topic right now.
No, absolutely. It's really booming in the entire, family medicine, internal medicine community. And then also it's made its way now into, medical aesthetics and wellness clinics as well. It's definitely, I would say these GLP-1s, which everyone's talking about, is like the new blockbuster drug, which we haven't seen one in a long time, but it's really just made a huge impact on people's lives, and they've seen such a great success with weight loss. But I think that there could be some downsides with the medication too, so you really need to just go to someone that's really, skilled, also knowledgeable about it, because they can always have, any medication has its risks. So it's really important to see someone that knows what they're doing, following you, monitoring you, and making sure they're prescribing you, the right thing for you.
And I feel like too, during residency, Cory, didn't these drugs kind of come about right? What year did they start coming about?
So they've been around for, at least 10 years, but I feel like they, just like any drug, right, when it hits the market, it takes a while to kind of really infiltrate the health system and start making an impact and then, making it well known. So they were around during my whole training over the last 3 years, but, majorly for diabetics. And I was prescribing them all the time for my diabetic patients. But then also, with the new FDA indication with certain drugs that, can promote weight loss, then we started seeing that.
Very cool. Mm-hmm. Okay. Love. So obviously now we started seeing, because there was such a demand for these medications, and then there were patients that wanted it so bad, but they were obviously upset because their insurance wouldn't cover it.
Sure.
So this now allowed for aesthetic practices, right, to kind of allow or offer this to patients, right?
Right. So, what we do is we make it very clear that, the weight loss drugs that we can provide, these are compounded versions of semaglutide and tirzepatide. These are not brand name medications. And that's really the distinction of why we can offer them. And the only reason we can offer them is because right now they're on the shortage list through the FDA. Once they're not on the shortage list, we can no longer offer these medications. Do I foresee that they'll probably be on the shortage list for a while? Yes, just because people want these drugs to promote weight loss.
And it's doing way more for people too, right? Other than just losing weight.
Yeah, I mean, right now the studies are showing obviously it's decreasing blood sugar, which is why we see the benefits with the diabetics, but also, obviously the weight loss is the major thing. But there's been a lot of anecdotal, stories from people saying, they felt like their inflammation is decreased. You've been hearing the GLP babies, so people have been getting more pregnant on these medications that maybe
my God, I heard that.
they wouldn't, there's no studies to show okay, this is, a causal effect, but just anecdotal stories. So I think there's a lot more to come and a lot more research that's being done and a lot more, studies that will reflect these new benefits for these medications.
Yeah, because it does a lot for when you get your metabolism going and fix the blood sugar and all that, definitely inflammation. But it definitely helps a ton of things, not just weight loss. So I can totally see that.
100%. And we've had a few patients. One of them has lupus, and she's been on semaglutide for about 8 months. And this is at another practice. And she was reporting to me how she has gotten her ESR, CRP, which are inflammatory markers for her lupus, checked pretty regularly every 3 months because she was having a lot of flare-ups with her lupus. And her inflammatory markers have almost doubled or tripled down since she started this medication, and her flare-ups have been much less. So, and I think that's kind of what you were talking about, right, Cor?
Yeah, no, absolutely. Like I said, I think there's going to be more to come with more studies to show, additional benefits of these medications. I think there was one recently that showed, just the cardiovascular benefits. So decreasing cardiovascular mortality, obviously, because if you're at a healthier weight, your lipids are better, your blood pressure is better. Obviously, that's going to improve your cardiovascular health. So I think there's so much more to come, and there's a lot of benefits. But also, with that being said, is there more side effects? Is there long-term side effects that we just don't know yet? Maybe. But I think that's just what, the medical community is reporting right now.
Sure. And then what is the, because I get this all the time, Cory, and I always relay this to you during their consultation. But what is the difference between semaglutide and tirzepatide?
Sure. So semaglutide is a GLP-1 agonist. So that's the mechanism that it acts on. Tirzepatide is a GLP-1 and it's a GIP. So it's acting on two receptors instead of the semaglutide acting on the one receptor, the GLP-1. So the tirzepatide's got that dual action effect.
Okay. Is there a reason why you would put someone on semaglutide versus tirzepatide?
So, in my family medicine training, it would be, okay, if I started diabetic on one of those medications, for instance, it would be, insurance coverage. Is insurance going to cover one or the other? For weight loss, we're seeing, that the tirzepatide's actually, and that's the brand version, not the compounded, and I want to make that very clear, is that the tirzepatide did show that they had like a 25%, decrease in their weight. And that's an average, where the semaglutide was more of 18 to 20%. So, if you have someone that maybe needs to lose a little bit more and you want them more of their goal weight, but it's maybe 80 to 100 pounds that they need to lose to get at that goal weight, maybe it's going for the tirzepatide just because it's showing that 25% weight reduction instead of 18 to 20 with the semaglutide. And this is all just shown in studies.
Very nice. And I think I want the people listening, because I think this is such a huge topic, and just kind of elaborate on your consultation. What does that entail? And from start to kind of finish.
Sure. Yeah. I mean, I do a full, history with them. So going through their family history, because that's very, very important with these drugs. One of the contraindications is MEN syndrome. So that's really getting a good family history, because if there's any family history of that, they're totally, that's a contraindication. They can't be on these medications. I go through their, medication lists. So you want to see, are they on any other medications, blood pressure meds, just a full, you want to make sure that you're even reviewing any over-the-counter medications. And then any surgical history, doing a full history and physical that we all, had to do back in school.
Oh, yeah.
And really go back down to the basics. And then, I then do some nutrition counseling and see what has worked for them, what hasn't worked for them. Have they tried exercise? What have they done that's failed, or what have they done that's maybe, succeeded in the past, and then go from there. And for me, if I see that they can maybe get it covered under insurance, ethically, I think that that's the right thing to do. So I'll say to them, you have a BMI over 27 and you have a comorbid condition. I think you should talk to your primary care doctor and get this covered under insurance. And if you can't, you can always come back. We could discuss doing it here, but I think just ethically, that's just the right thing to do. And I always ask them too, have you talked to your primary care doctor about this? Are they on board with this? This is a compounded version of the medication. So I just like to have everyone in agreement of the plan before we move forward. And that's kind of how I frame it.
I think with it being a compounded medication too, people can get it online now, right? There's a lot of unsafe ways that you can be getting this medication or being prescribed, quote unquote. So I think, seeing a medical professional, especially getting cleared by your doctor, but making sure that you're being followed up with. If you're just being prescribed 3 months of this and you're sent home with it and you're supposed to do your own injections and you're not following up with anybody, I think that's where it becomes unsafe. And I think that's why finding a medical provider that takes this, very seriously and ethically is really important.
Yeah, and even, with these medications improving, cardiovascular health and everything too, getting a full set of vital signs. We do that in the office during their visit because, if they're on a blood pressure medication, now they're on these medications, is their blood pressure getting, lower? Is it dangerously low as they start losing weight? So, it's really important to follow up with them, monitor them closely, and then, get a complete set of vital signs, do a physical exam, all of that stuff.
Yeah, that's so true because that's things you don't even think about, right?
I know. Yep. And do you think it's necessary to obtain blood work while you're on these kind of medications?
I think it really depends. One of the big things, one of the major side effects with these medications is pancreatitis. So, if they have any personal history of pancreatitis, they should not be on, or it should be cautiously used. So, if you're suspecting that they might have a pancreatitis flare, obviously that's where labs can come into play. If you want to get that covered under insurance, you might need to get labs. I think it's individualized and not everyone needs labs, but some people might.
Yeah, and I think the biggest thing to me, especially, as a business owner and also in the community, right? Making sure full transparency with your primary care provider is so important because, you wouldn't want to do something behind your primary doctor's back. Also, as a provider ourselves, we don't want to be doing this and not letting them know that this is happening. So having that full transparency and trust, I think, is super important. And also for the patient too.
Absolutely. Keep them safe. Yeah.
Hey guys, just popping in to remind you to subscribe, and hit the bell for notifications. Also, don't forget to follow us on Instagram, Injector Jon and Aesthetic Nurse Nicole. Thank you so much for watching. And if you have any questions, leave it in the comment section.
Yeah.
Is there a cutoff? So if I were to come to you and be I want to go.
You don't need it. Goodbye.
Yeah. No, and I would never. I'm just saying, we see this all the time.
Yeah.
Is there a number that you would be absolutely not?
It's a good question.
No, that's a really good question. Obviously, there's, off-label use we have used off-label use for many drugs in the past. Obviously, you guys do that with injectables too, I'm sure. Would I say there's a personal cutoff for me? No, but I think if someoe's at a reasonable weight and they just, want to lose 15 or 20 pounds, I usually say no and I don't give them the medication.
Yeah, makes sense. Yeah.
That makes sense. Have you tried lifestyle modifications? Have you tried working out?
Yeah.
Okay, are you doing it? So what if they say, no, I have been. I've been working out, I've been eating healthy, or eating half what I normally do, or, cut out, breads and stuff. What would you say?
I usually always pivot and I'm well, have you tried this? Have you tried that? And I find one that they haven't. And then I say, listen, I think you should try this. And usually they're pretty, these patients are pretty reasonable. And, because I go into, a huge conversation with them on like, this is an injectable, like everything has a risk. You're injecting your skin, you
Sure.
can introduce infection. And then they're like, oh, hey, you're right. Before starting a medication, maybe I could try like some conservative management, especially if they only have, or their goal weight is they want to lose like 10 pounds or 15 pounds. I don't think it's really worth, going and doing the injectable.
Right, right.
Have you had any patients status post or after gastric bypass that qualified to be on this medication? Can they be on a medication like this?
Yeah, so there was a study that showed gastric bypass with a GLP-1 medication has promoted more weight loss than just having gastric bypass alone. And I know that some of the bariatric surgeons, I actually had a lecture on this when I was in my residency training, that were recommending doing both together, actually. Obviously spacing them out and, working with your bariatric surgeon on doing them. You can be on them together, but if I had a patient come in to a medical aesthetics practice, like for us, I would probably say, I wouldn't prescribe that to them. I would want them to go through like their bariatric surgeon or through their primary care.
That's a good point. And the way that I think about it, and please correct me if I'm wrong, is right. It's slowing down the gastric emptying. So it's slowing down anyway. And I know in the very beginning, after gastric bypass, you can only eat so much at a time, right?
Right.
So it actually does make sense, right? To almost help directly after having the surgery.
Right.
Yeah, because a lot of what it does too is it does curb like cravings, right? Like it does help kind of suppress the appetite in a way.
Yeah, so there's it decreasing like the food noise, we call it. These receptors act in the hypothalamus too, so they can decrease that hunger feeling that the food noise that we keeps us up at night or keeps us up late at night snacking.
So got me to DoorDash McDonald's last night.
Yeah,
I literally woke up at 2:30 a.m. the other day, and I was like, I'm gonna go get a snack, and he goes, "What? At 2:30?" I'm like, "Dude, don't. I can't. I know
Don't shame me."
in like 3 weeks, but I need some chicken salad. Anyway, keep going.
So I hear a lot, because I don't personally work with this medication, but a lot of my patients obviously are prescribed it. And I hear a lot of the time that when they come off of it, they feel like they almost kind of rebound in a way, or they've like been tapered off of it, but feel like they can't get off of it. Like, what are your thoughts on that?
I always reiterate with the patients that this is a tool. This is not just a medication that you give yourself and you lose weight on it. It's a tool to help you lose weight. So the goal would be not to be on this like forever, but it would be, tapering off, maybe going on a smaller dose, and then you maintaining it with lifestyle management. So you get to your goal weight, and then you want to, try to obviously eat right, exercise, and keep the weight off that way. So I always reiterate that this is a tool to help you lose weight. It just doesn't make you lose weight by giving it to yourself.
Right.
So I think that's the most important thing. I think that's a part of like what people miss too.
Absolutely. They just think they're going to take it and it's going to melt off.
Right.
I know. Okay, so we have like a million questions for you, but
Sure.
Now that we're on this topic, what do you think are like the next waves of the future for medicine, whether it's more functional medicine or aesthetics? Like, what are you seeing like in the functional medicine space?
Yeah, I think functional medicine as a whole, I think, is like the more holistic approach and seeing a patient as an individual and, what their concerns are. I think hormone replacement's becoming very popular. And I think, obviously gut health is just exploding. And now we're seeing like biological age testing, like with the Kardashians. So I think that can be on the rise as well.
Is that the Pronovo?
No, that's Pronovo is
The
like
CT
imaging,
scan.
MRI. Yeah.
MRI, which I need. I want that.
Don't do that, please.
Listen, I want to know what's going on. Sometimes I just want to say I broke my nose to get a CAT scan of my brain to make sure everything's okay. But
Just double check.
just to double check. But we don't need that radiation.
Yeah, I think also like you're seeing bone density scans being done in an aesthetics practice at a young age. So getting like a baseline density scan. I think there's so many more things to come with it. And I think that this is just going to group together with like injectables and skincare because it's just looking at the whole body and the whole wellness aspect of everything.
Absolutely. Because, we forget we age in other ways than just visual,
100%. And this is something that we want to, weight loss is just the beginning for functional medicine at my office. And I think for sure, you said hormone replacement therapy, HRT, has become really, really popular. And that's something definitely that we're going to be bringing on in the near future. You've mentioned before, like PRP, like joint injections.
Yeah, PRP for joints, which
we use PRP for so many things in aesthetics, but now it's gotten really big in every day to day.
Yeah. Oh, yeah, absolutely. I think that's definitely more to come too, and I would only feel comfortable doing that with like ultrasound and stuff. So like, I think ultrasound is on a wave too with aesthetics in general too.
Which you've talked about, Nicole.
Yes. Yeah. We just recently got one too. So we're learning so much about that.
Yeah. It's a whole nother aspect to learn. I mean, I think there's going to be so much, the next 10 years, I mean, it's just going to explode.
Agreed.
I know. There's so much going on out there.
I've looked into potentially offering these medications here at Exhibit, and I learned a lot about pharmacies and compounded medications and how you really have to do your research on those as well. Do you guys I know when we were looking into compounding pharmacies, there's like third parties I guess pharmacies can go through to get their medications tested. I feel like that's another thing that patients don't realize, that we really, as providers, look into where these medications are made.
Sure.
And if you're getting it online and things like that, you don't know where the compounded medication is coming from. So your thoughts on that?
Yeah, I think that's a huge, huge thing. I mean, I was very, when Jon and I sat down to talk about it, we wanted to roll this out, just to roll it out, effortlessly, and then also, but ethically too. Compounding pharmacies, I want to reiterate that they're not FDA approved overall. So, but they do offer different compounding pharmacies. They hold the medication for a certain amount of days. They do quality testing on it. So the one that we chose is, it's got very high standards. They hold the medication for a long time. They do quality testing on it. So,
it's very controlled.
Yeah, I think that you want to offer the highest quality to your patients, and you want to be careful,
And we looked at a few.
Yeah,
and we were like this close for a couple of them, and then he was like, "No, I don't get a good feeling about this," so we ended up not choosing it.
I think what you guys ended up going with was one of the pharmacies that me and Melissa were going to go with as well if we did it, because they do offer that.
We also obtain our IV supplies from there, our IV like vitamin infusions and things like that from the same company.
It's almost like vitamins, like same thing with vitamins. It's anything. When you go over the counter and buy a Nature Made or any kind of vitamin, those aren't always tested either. So they go through third-party testing to kind of prove what's in their medications too. So it's very similar.
Yep, absolutely.
So, honey.
Yes.
So
I love that.
I love it so much. So what inspired you to, I've asked you this before, but I don't think I've actually, professionally asked you this in an interview. But what inspired you to get to where you are today?
I always really enjoyed the sciences, and then I was always volunteering as a kid. I guess I was just maybe an overachiever, or I wanted to always just prove myself. So when I
#childhood trauma.
I love the honesty.
Yeah. I definitely always knew I wanted to do something in healthcare, whether that was pharmacist or a PA or nursing or what that be. So it didn't really come easy to me in school at all. I was definitely just an average student, but I always worked really, really hard. I had to study hard. It was always it took me double the amount of time to do something compared to my peers, but the work ethic was there for sure. And I went to undergrad, and then I was I'll give medical school a shot. And because I just really I wanted it so bad, and then when I finally got into medical school, I was to pick a specialty was the next biggest hurdle. And I thought family medicine just fit my personality the best, but just the holistic approach, treating the whole family unit, and then just really just being there for your patients, having that family aspect of everything. So that's kind of why I wanted to go that route.
That's
It's
amazing.
Yeah.
I thought that I had problems stepping away from the patient. Like my medical assistant's always like, time.
Let's go.
Yeah, looking in the background. But this guy, I mean, he's sitting, his bedside manner is so good. And I know I'm biased, but seriously, just from like a bystander, I feel like I need to increase the amount of time in your appointments. Because he definitely goes over and he does not mean it.
Yeah,
He's all of a sudden like, oh my God, where's the medical
I
assistant?
know, but you're talking, you know.
Well, you
No,
connect with
absolutely.
people.
The right thing to
I think
do.
connecting is so important.
Nowadays it is. It's so important. You don't get that, anymore.
And people wanna
It's
be
so
heard.
important. Right. Absolutely. Absolutely. And I feel like too, when they come in, even if it's just for like a weight loss consult or something else, you as a family physician can hear kind of things that they might be telling you, and something else might go off in your head and be like, you know what, have you been tested for XYZ? So it's definitely that holistic approach for sure.
Right. And it's just so crazy, like looking back, like the past year to 2 years. I mean, how crazy this exploded. Like GLP-1s exploded and people did not care. I mean, there's some patients that, you hear from and you're like, wow, like they don't care about medical history. They just want to lose weight. And, and that's why, when we started, and I got asked a million times from my own patients, I know I'm sure you do too. When are you bringing it on? I want to support you. And of course that means the world, but I know for me, Nicole, and I know you could probably speak to this too, my passion isn't weight loss. It's injectables. It's, skin, right? So, and I knew if I were to bring on that program, I would want it to be someone who has that passion and would do things the right way and ethically the right way.
Exactly. Yep. That's our thing. Like me and Melissa both, we're both so heavy with fillers and Botox, and to bring this on and have to really, you really do have to know it like the back of your hand. So you have to learn it. You have to have the time to sit down and do these consults and do the tests and all that. So yeah, definitely it would have to be another provider. So I say, Cory, come on down.
Yeah.
To New Jersey, get your Jersey license.
These are like once a month now.
Oh my God.
But no, I think it definitely does need to be another provider so that you have the time for it,
Yeah. No, and I think
100%.
it's like important just to do stuff you enjoy in the profession and do stuff you're good at and,
course.
that you have passion for. So
Absolutely,
you're
absolutely.
doing it right.
That's amazing. Okay, so I think some of the listeners, are physicians to this podcast as well. So I think it's really cool to have you on as well, and to have a different perspective on like healthcare and aesthetics and all of that. Your journey was completely different from us to get here. So talk a little bit about your like residency and what it entailed. I mean, you also completed residency kind of during COVID as well, or just
I was going into it during COVID. So, I mean, I guess my journey was a little different compared to everyone else, and Jon can attest to this, but when I went to medical school in the Caribbean, I went to Ross University School of Medicine, so that alone is just, a whole separate journey in itself.
Do you know someone who went there, Nicole?
Not human medical school. They somewhere veterinary.
cool. That's
Yeah.
cool.
Yes.
Yeah.
Yeah,
We
so
did too, actually. We went to, anyway, keep going.
So when I was, I went down there, and when I was there, a hurricane hit, so I had to be evacuated, and it was, then I ended up in Tennessee and relocated. So that was definitely, a challenge for sure. And then for my clinical rotations, I was actually in New York City for a year. So I was in Queens. And then the last year was when COVID was starting to hit, like 2020. And that's when I did some away rotations. Most of them were in Syracuse. I did some online rotations, so that was really nice. But going into residency, that's kind of when COVID was more controlled. And it was definitely, going from a med student to a resident is like kind of your first or second year is like an NP for you guys. Really just getting thrown into it, learning medicine, having to do full assessments on patients, prescribe. So that was definitely a learning curve, but I loved it. Yeah, I had a great residency and I had a great education overall. We were pretty independent, and I had a lot of good experience. So
I'll never forget that working in the hospital. Like
Yeah.
when July came around, all the new residents come. They'll be in the huddle and they're asking questions, and you're like, I can tell you the answer to that. Let me know. I'll
Yeah,
help
it's
you
kind of
out.
scary because you go from, in June of before you start residency, you're just, a medical student. And then that July 1, it's like, okay, they're calling you Dr. Stewart. What do you want to do?
Right,
You're
yeah.
looking at your senior.
And
And
people
Yeah.
don't realize that they are doctors during residency
Mhm.
because some people go, "Oh my God, he just became." I'm like, no, like he's been one. Like,
Right, right.
we called him Dr. Stewart during residency.
Yeah, yeah.
Doctor in training, yeah.
Dr.
Yeah,
Stewart.
yeah.
That's
Yeah.
so funny.
How long is residency?
So for family medicine, it was 3 years, and that's the least amount for any residency. So like internal medicine's 3 years, psychiatry's 4, but yeah, the pediatrics is 3 as well. So it's at least 3 years. The surgical residencies are 5 plus.
Yeah,
So as you become more specialized, you're going to do more training for sure.
of course, yeah. I have heard a couple of people actually tell me that they've had patients like lose their gallbladder while on the medication. Is that people that have like pre-existing conditions probably, or?
I think it depends. You can have gallbladder issues, when you're on these medications. So, that definitely can happen.
Makes sense, especially if you're eating something fatty. It's
Yeah.
slowing down gastric
And you have like
emptying.
underlying gallstones or
Right.
Right.
things like
It's
that.
food staying in there longer, so it's causing a biliary colic.
Yeah, yeah. I guess that's my fear with people buying their supply online. Like you don't know what they're dosing themselves with, like
Right,
even though
right.
they're being told something, are they doing it correctly, or are they deciding to up their dose a little?
And I think that's why it's so important to see a provider, to see an NP, PA, MD when you're managing these medications. See them monthly. How are you doing? How are you feeling? How much weight are you losing?
And I think it's also, you need to really clearly just state, what are some possible side effects? What are some risks? Obviously the benefit of everyone wants to hear, am I going to lose weight? But you really need to go through the risk benefit analysis. These are some possible risks that you can have gallbladder problems. You can get, slower, obviously the gastric emptying slowing down is going to cause maybe some constipation, some diarrhea. Acid reflux might increase. Obviously there's a risk of pancreatitis. So going through all of those things with the patient is so important.
And I think not jumping to just increasing the dose every single month, right? Being like, how are you doing? And this is what I was going to say before. Like, if they're actively losing weight, the side effects aren't bad. Keep them on it. Don't just up it like that. If they're losing 10 to 15 pounds in a month, I mean, that's remarkable, right?
Yeah,
I think
that's a lot.
dropping it, he goes, that's a lot. Maybe that's a little too much. Is it too much?
I mean,
Might be.
yeah, like safe. You want to be able to lose like 1 to 2 pounds a week.
There we go. That's the safe amount. Okay.
I mean, that would be the best case scenario, but
John's on a lot of packages for you right now.
yeah. Losing too much weight too fast is obviously you don't want to burn through your muscle, and you want to keep up your muscle mass and make sure you're eating enough protein, and
Right.
you don't want to decrease their caloric intake too much either.
Yeah. And many people, I think the biggest obstacle is, when do I eat? I think you just eat when you're hungry. If you're so used to eating breakfast, lunch, and dinner, I think that's where you'll learn. You're like, okay, like I'm not hungry right now. Don't eat. If I'm hungry now, I eat. And then just listen to your body. And as soon as you're not hungry anymore, stop eating. If you're just going to force yourself to finish a whole meal, that's when you can get sick a little bit.
Makes sense. Are you guys pairing any IVs with this
Yeah,
treatment?
talk about our package core.
Yeah, so we're doing IV therapy. We're packaging it with that, so like it can help with any side effects, nausea, vomiting. And then just hydrating them too as well. So if they become a little dehydrated.
So they can receive a Myers cocktail. So it's 1 liter of normal saline fluid. We usually administer over 45 minutes. Just normally, if you offer IV hydration, that's what you do. You can add Zofran to that to help with nausea. But obviously, these vitamins are going directly into your bloodstream. So it's just a really nice way of making sure that you're staying hydrated and that your electrolytes are normal during the whole process. Because, as you're eating less, there's always that chance of, your electrolytes being off and things like that. We're also selling, peptide bites, right, in the office in conjunction with it. These can take the place of your multivitamin. but it has B12, B6, choline, and then it has like your normal potassium, magnesium. So it's going to help with nausea more naturally instead of just getting Zofran, right?
Yep.
Like sublingual and things like
So it's
that.
got the B6 in it.
There was a med spa in like Texas. This was months ago, but they did a very similar kind of IV cocktail. I'm not sure what was in it, but it was electrolytes. And the patient actually went into cardiac arrest and was in a room by themselves, and they actually passed. So
I did hear about this.
yeah, just, you know, I guess, do you do any kind of, obviously you guys do, but like history before, like ways
yeah.
to avoid that? And obviously you don't leave the patient by themselves.
I think the biggest, learning from that is to make sure that, like you said, you're doing your proper history. Are they already on potassium or magnesium supplements? Because those two, if they're already on those supplements, I probably wouldn't give them, a Myers cocktail or something like that, because there is a chance that you might give them too much and it can cause like a fatal arrhythmia, which maybe that's what happened. And
Right. Yeah. I'm guessing they probably had some kind of cardiac history that maybe they weren't aware of.
Right. And maybe they had, we always screen for cardiovascular or kidney disease, especially if they have kidney disease and we're giving them these electrolytes. I mean, they're not going to be excreted the right way, and they can get wound up in your system longer than they should have, and it can cause a fatal arrhythmia. So yeah, I think that just basically that situation was so unfortunate, but in medicine, it was a good learning experience for people to make sure that they're doing things the right way.
Yeah. And I think in a lot of other states, you don't always need a medical professional there. I think that's what happened. I think it was a non-medical professional providing the service.
Yep.
And maybe that, maybe not the right background was taken. But definitely, again, for patients listening, it's so important to make sure you're seeing a provider that does these things and takes the background and knows these things about you. And God forbid, if something were to happen, they know how to treat it.
Sure. Yep. No, I think that's the, really the takeaway message. Like the conclusion is going to someone that you trust, someone that's got experience, and that's someone that's going to just do the right thing at the end of the day and has your best interest at heart.
So Cory, I know you are just now kind of getting into the aesthetics and everything and started this weight loss program. Is there any advice that you would give to anybody looking to get into this field?
So I would say I'm going to be, because I've already joined with Jon, obviously, and I'm going to be doing like full-time primary care. And then part-time, I'm going to be, with him doing aesthetics. But I was very blown away on, how much learning and how much, just understanding of anatomy and everything you need. So just me learning Botox, I was like, wow, this is a lot harder than it looks. I know it can obviously look easy from like the, an outsider's perspective, but even me being a physician, I mean, going back to, semester 1 of anatomy, gross anatomy, I'm like, wow, like, the way you're talking about the muscles and how they work, I mean, you really need to know your stuff. So the advice I would give people would be just really take it slow. Don't dive into it too quick. And just really, really kind of learn the profession before you, start treating people.
I love that because it's so important. Yep, so important. So true.
It was like shocking to hear that because, he did gross anatomy. He's dissected faces, right? I know.
Well, not too long, but I mean, long enough that I'm like, oh my God, the Procera is like, oh.
And guess who taught him in medical school? Professor Codafana.
Yes.
No way.
Yes.
I'm so happy to hear that.
I know. He did our head and neck anatomy.
Oh, that's amazing.
At Ross University. Yep.
He said he was incredible.
Wow.
Thank you, Dr. Codafana. Yep. Yeah. So it's so funny because now I see how he's just such a pioneer in the aesthetic community.
Absolutely.
No, it honestly meant the world. Like when he said that to me, this was last week that he said the same thing that he just said, and I was like, wow, that's really cool.
Yeah.
It like
Full circle. That is a full circle.
Good because it is true. I mean, we preach about it all the time, Nicole, how like people think it's so easy to throw a syringe in someone's face and we'll do this exact design on every single person where we're going to inject. It's not the same in every patient. Yep. And I know for you, like learning like the line of convergence and things like that in the forehead, like it just takes a minute. Like you're explaining to patients what your muscles are doing. If we do inject Botox here, this is what it will do, right? So it was really cool.
That's actually so funny too, because when I went to Codafana's cadaver recently in Florida, he made a comment. He was like, I teach anatomy, and if any of you had me as students, you probably didn't care back then. You just wanted to pass, and now you're all sitting here paying, watching.
Yeah.
Now you care. That was
We
just
just
funny.
wanted to know what he was going to test us on, right?
Right, yeah.
You're like, I'll never see you again.
Yeah. But here we
Now,
are.
now he's one of the biggest names in
I know.
aesthetics.
Yeah.
The whole journey it's really impressive to me. I mean, just even learning Botox from Jon and assessing patients, I'm like, wow, every forehead is really different. I don't think you've seen the same two, and you guys could probably speak to it more than I can. But yeah, I mean, it's just, I would say it's a journey. It's not a race.
Yes.
To learn the craft, because it really is a craft, and I think you need to take it slow. So that would be my biggest advice.
Yeah, and that's how we do it here too. We kind of start, training with the Botox, and then move to lip filler, cheek filler, and then more high risk areas. But definitely taking it slow is the way to go. Just getting a feel for the syringe before you even touch it to someone's face too. I feel like that's so important as well.
Yeah, how to hold it, how where to inject, where the patient's sitting, and just positioning, and there's so
What's
much
a unit, right?
Moving their head, you know what I mean? Because I'm like, no, touch their face, move it towards
Yeah. So
hurt your back.
Use the patient to your advantage. Yeah. It's so funny, even teaching a unit versus 3 units of Dysport. It's a different language.
It's that too.
Yeah.
Well, it's so funny. We all, do things differently, right? He is extremely, he is organized list doer, right? I'm not so much the list doer.
I'm you, Jon. I am you.
Yes, we're the same. We are the same. He's just how do you know the 1-to-1 dilutions for here and the 2-to-1s here? How do you make sure that you're injecting the 1-to-1 in here? Are you getting the syringes mixed up? I go, well, I put the 1-to-1 bottle here. I put the syringes here, the 2-to-1 bottle here. He is taking a white marker and writing on the patient. Kybella, frontalis, crow's feet, 1-to-1, 2-to-1, which honestly is the best.
Great. Yeah. You'll never mix it up.
Yeah.
You'll never mix it up. Definitely that's not how my brain is, but we're all different.
Yeah.
And I feel too, once you get to a certain point, you probably won't do that anymore,
Right. Yeah. But in the beginning, you're just so making sure, right? Which is good. That's how you should be.
Yep. Of course.
So, oh my God. Well, thank you so much for coming.
Yeah, this was amazing.
Thanks for having me.
I know you're a busy man, so I appreciate you giving up.
Yeah,
time.
thank you for taking
you guys.
Oh my gosh.
Oh yeah, and Cory, where can everyone follow you on social media?
Oh yeah, so I'm on Instagram. I'm Dr. Cory Stewart. So give me a follow.
Absolutely.
Yeah. So you can follow him along on his functional medicine / family medicine journey.
Yes.
On there.
I'm sure you guys too on your Tox and Pout page will post, stuff about the weight loss program and stuff. So put that in there too.
All right. Well, thank you guys so much again for tuning in to this week's episode of the Fill Me In podcast with our guest, Dr. Cory Stewart.
Thank you guys.
Thank you so much again. We look forward to talking to you guys soon.
Bye.